What is the next thing? There is a canal. What do you have at the end of the canal? There is a membrane, which is called the tympanic membrane, and there is a small cavity called medullary cavity, which has a tube here, and the small cavity has 3 ossicles. So I draw 3 dots, and then there is an inner ear with the cochlea and the vestibule. And from here, it now carries a signal to the cortex in brain, where you finally hear the sound. What is this called? This is called the line diagram. This is a line diagram of ear. Now the advantage of line diagram is it's very easy to draw, like you can make out. Very easy to teach and learn. That's what we are doing right now. Very easy to remember. That's the most important thing for you. And reproduce in the exam. I mean, reproduce in the sense, the knowledge of the. I don't understand. You know, like इसको करके reproduce हो जाएगा. भारत में होता है ना, आंखों में बच्चे हो गए. Okay, and the disadvantage is that it's not very accurate. The only downside is that these are not very accurate. That doesn't matter. It tells you most of the thing. Now, first off, let us know the names of these various parts. What is this first part? Yes, I cannot speak louder. There is something problem with this. That speaker has to be addressed. My speaker is max. My speaker means I tell you. Thank you. Is this better? What is this? This is called a cortical. Commonly called it pinna, but the correct biological name is auricle. This portal is called the external auditory means. And this whole thing becomes the external auditory canal. This tympanic membrane is also called the meningus, and the middle is called the tympanic. This is Eustachian tube, and this one is the labrum. Okay, so these are the terms that we need to remember. Especially meatus. Meatus is important. Meningus is important. And tympanic is important. These 3 terms are extremely important. Meatus, meningus, and tympanic. Now, why is this terms important? Suppose they ask you what is, let's say, meningoplasty. What is the word plasty mean? Which part is the external ear? Which is the middle ear, which is the inner ear? This part is the external ear. This much is the middle ear, and this is the inner ear. So this is the beginning of ENT. The first diagram is this, which shows you the different parts of the ear, and you must remember the names of these parts. The biological name actually. Which part is the most important part for the exam point of view? where they actually ask you questions, is the middle ear. Middle ear is extremely important. So middle ear you have to know inside out. We'll do in details. External ear, inner ear, not so important. So we will do passing. Let me start with external ear. Tell me, what does external ear comprise of? What are the parts of the external ear? Pinna, canal with meatus, and the outer surface of the tympanic membrane. Tympanic membrane is, if you look from outside, the outer surface is a part of the external ear. So auricle, which is pinna, canal, and the meatus, and the outer surface of the tympanic membrane are the part of the external ear. Now, okay, I have to create pages here. So I have to go back. My same here, Lali. I can't change the slide here. So what do I do now? If I create more slides, then I'll not be able to show you images from the previous one. The screen sharing का फायदा क्या होगा? Press कर चुका हूँ उससे नहीं हो रहा. Control C. Anything is guy outside? Is he ready? Lalit, take a look. And our pinna, which is, what is the pinna also called? Auricle. The few things you have to know: the development of pinna. Where does it develop from? Any idea? What does pinna develop from? It's a very important MCQ. It develops from first and second branchial arch. Pinna develops from fusion of first and second branchial arch. And the second question, what is pinna made up of? Pinna is made up of elastic cartilage, except there are two parts of the pinna which does not have the cartilage. And this is what we ask. Which is the part of the pinna that does not have the cartilage? Any idea? One is lobule. This is not important. The other which is important is incisura terminalis. And this name is very important name, incisura terminalis. This is an MCQ, very commonly asked MCQ. Name the part of the pinna that does not have the cartilage, incisura terminalis. So these are the two questions from the pinna, very commonly asked. It develops in the first and second branchial arch, and the fact that incisura terminalis does not have the cartilage. So if I use this diagram, and if you divide it here, this whole thing is made up of cartilage. That's why pinna is also cartilage, because pinna falls in this area. Now, if pinna is cartilage, what is this rest of the ear made up of? It's inside a bone, so it's called bony ear. So outer part of the ear is made up of cartilage, and inner part of the ear is inside the bone. So there are two parts, a bony part and a cartilage part. And the question is, which bone is this? Which bone is this? Any idea? This is this green bone called the temporal bone. So ear is mainly inside this temporal bone that you see, the green bone, which means that if they give you the image of the skull with this bone, they should be able to identify this bone. In fact, you should be able to identify all these bones of the skull: the frontal bone, the parietal bones, the temporal bone, the occipital bone. This is the major bone. This is occipital, this is parietal, this is frontal, and this is the temporal bone. If you look only at the temporal bone looks like this. If you remove the temporal bone, forget the rest of the skull, this is how the temporal bone looks like. The first one is a medial view of the temporal bone. That means you have to go inside the skull and look at it. And the second one is the lateral view of the temporal bone. And temporal bone is not a single bone. This in turn is made up of how many bones? 4 bones. This is a combination of 4 bones. Together it's, temporal bone. Like a country is not a single country, it's made up of many states. India has so many states. So similarly, temporal bone has many bones. But from the ENT point of view, out of these bones, which is the most important bone that you have to know? Can you see this triangular bone, this one? This triangular bone is the most important bone out of the temporal bone from the ENT point of view. What bone is this? Somebody is calling petrous part of the temporal bone. It's called petrous part of the temporal bone, or you can call it petrous bone. And you must have realized already that the petrous bone can be seen only in the first way, the medial end. You cannot see the petrous bone from outside. So if you look in this diagram, you can't see the petrous bone. There is no petrous bone. To see this, you have to go inside the skull. So that's why you can see the petrous bone only from the medial end, the inner end. You cannot see it from the outside. And I told you, this petrous bone is the most important bone from the ENT point of view. Why? Because ear is actually inside this petrous part of the temple. This bony part of the ear that we talked about, this bony ear is actually in this red bone, this red triangular bone that I made. It is inside this. So once again, ear is located in which bone? If I ask you, what do you say? In the petrous part of temporal bone is a complete answer. So we are saying bone. Where do you stay? I stay in Delhi, in India. If you say Delhi, in Tamil. If you say India, if you say Delhi in India, then you give full information. Those who know Delhi will know that we are in Delhi. Those who know India, they will know in India. You give your full information. The petrous part of the temporal bone. This is one important. The second importance of the petrous bone, general anatomy, is that this is the hardest bone of your body. Petrous bone is the hardest, the toughest bone of your body. The word petrous means rock hard, rock hard. Then from there you get the name petrous. So it's like rock hard bone. And therefore it is very difficult to fracture this bone. You can't fracture petrous bone easily. So why do we need such a hard bone here? Such a tough bone here? Because this bone has to protect something very special. And you know what is that special thing? What is inside this bone? Ear. Especially the inner ear. The labyrinth as we call it. Labyrinth is very special. And that's why it needs a special protection. Jet security, like Prime Minister of a country. It's a jet plus security. So this petrous bone is a jet plus security for our very special part, that is the labyrinth. So what does labyrinth do? Why is it so special? What does labyrinth do? Why is it so special? Why is even such a special protection? What do you think? See, knows the answer. Say. So, it contains the cochlea, therefore, function. Cochlea does not do the balancing. Cochlea is for hearing. Who does the balancing? The vestibular. So, it's about balancing, not about hearing. If you don't hear, your life is not going to end. You have discomfort, but if you cannot balance the body, then you can't stand. You can't walk. Even when you sleep, the whole world seems to be going round and round. Chakkar ana, as is called it in Hindi. So without balancing, your life is screwed up badly. Right? So balance is very, very important. The main function of the ear is not hearing. That's what we think. It can't just deny that. That's not the main thing. The main thing about the ear is that it balances your body. Because of the ear, the vestibule, you can stand, you can walk, you can run, jump, turn. All that is your body is always balanced. You don't fall down. And you take away the vestibule, ear, nothing. You can't even stand. You're not going to walk. You're not going to run. Nothing. You have to lie down all the time. And that too, you will feel that everything is going round and round and round. So it's very, very difficult. Can you imagine a life without balancing? You can't live without balancing. That's why balancing is very, very special. But balancing is very complex also. It entails many other aspects. It's not only ear that does the balancing. Balancing is also required your vision. Vision is also quite, eye is also special. And there's something called the proprioceptors, which are nerve endings in the neck. That's why when you turn the neck, you have to know, your brain has to know what direction you're looking at. So that's balancing. So these three things, that is ear and eye and the proprioceptors as we call them, they send the signal to the cerebellum in the brain. And cerebellum is like a master balancer. That's the main thing that is finally balancing. But it needs the input from these three things. What are the three things that gives the input to the cerebellum for balancing? I just told you, the ear, which is vestibule, the eye, which is vision, we call it, and the proprioceptors, the nerve endings are the joints of the neck. These things, they send the signal to the cerebellum in the brain, and brain, upon receiving the signal, will do the final balancing. Which means that if any of the four is gone, whether it is ear or orbit or cerebellum or these proprioceptors, a person can have imbalance. Imbalance is not only ear always. So maybe it is an ophthalmology problem. Maybe this is orthopedics problem. Or maybe neurology, that cerebellum is a brain, neurology problem. So you have to find out. So it's a very complex subject. And the patient is complaining of vertigo, which is a chakkar. He comes to the ENT. You check up. You say, no, it's not ENT. You go to orthopedics. Orthopedics will check it. You say, no, go to ophthalmology. Ophthalmologist check it and say, no, it is normal. You go to neurologist. And the patient says, sir, पहले मेरे को चक्कर आ रहा है, फिर भी चक्कर लगवा रहे पूरे hospital में. It's very, very, and this is a very common saying in medical science, especially in ENT. We say this: when the patient has a vertigo, chakkar, the doctor also has a vertigo. So that's so difficult to diagnose and treat. Vertigo is very difficult to diagnose and treat. So हमें भी चक्कर आते हैं. So the best thing is don't ask questions. So they don't ask you questions. The good thing is they don't ask you questions too many. So they will always talk about hearing, because that is easy. So we are not asking questions from hearing part only, not because that it is important, because we ourselves don't know. This is a secret, don't tell it to anybody. हमें भी नहीं पता balancing के बारे में. तो आपको क्या बताएंगे? है ना? Okay. Because I cannot read ophthalmology and orthopedics and neurology. I can't master them, isn't it? So it's not possible for one person. And same goes for the ophthalmologists also. They will not know ENT so much. So it's not difficult, not easy to master balancing. And that's why the best thing is, जो नहीं आता उसको ignore करो. आँख बंद कर लो तो सामने से problem खत्म. Isn't it? This is what the duck does. When a snake comes, the swan sees the snake, gets scared and closes the eye. Buries the eye in the sand. उसको लगता है कि दिख नहीं रहा तो है भी नहीं. And then next time she opens the eyes, she's already inside the stomach of that snake. You can see the stomach, all the juices coming and trying to digest that. So by closing the eye, you can't ignore the problem. You have to face the problem. And so I face this problem. I read a lot about balancing, and I'm really good at balancing. I do a lot of balancing practice, and I can really teach balancing for hours and hours. But not for you, because we have to know what to teach and what you have to learn. Right? So here we are doing only very focused study. So we talk about hearing only. Done? So that was the pinna. And then we talk about the canal. Which is the canal? This one. This is a canal. External auditory canal with meatus. First question they ask is the length of the canal. How much is the length? 24 millimeters is the length of this canal, which is same as 2.4 centimeter. If you say 2.4 centimeter, that's also correct. Point number 2, what is it made up of? You know this. Remember, if I divide it here, this part is cartilage. Remember, this is a cartilage part, and this part is bony part. Is that we know this? So the outer is cartilage or bony? Outer is cartilage, isn't it? Outer 1/3 is cartilage. Outer 1/3 is cartilage, and inner 2/3 is bony. Next point. What is the lining of the canal? What kind of tissue lines the canal? Squamous epithelium, which is skin. So it's a squamous epithelium lining inside the canal. Okay. So these three things, the length is 24, outer 1/3 is cartilage, inner 2/3 is bony, and the lining is squamous epithelium, which is like skin. Now these three are regular, these 4 points are regular points. Everybody knows them, most of us know them, but they ask in the exam, so you have to remember them. And now we come to the special thing that is very, very important from the canal. There are 4 things inside the canal, and you have to know the names of these 4 things inside the canal. What are these 4 things? One of them is foramen of Santorini. Second thing is fossa of Hasta. Their hair cells and their glands. These are the 4 things that you have inside the canal. I need to remember these 4 names. They ask you. Like they'll give the name of the first one. Foramen of Santorini is which part of the body? Brain, kidney, ear, like that. So you know that foramen of Santorini is in the ear. Now the first 2 names out of these 4, if you read these names, these are fancy names. Most of you may not have heard this name. Many of you may not have heard this name. Santorini and Hasta. And our exam pattern, you know, they are fond of asking strange names. Whenever there is a strange name, it's a question straight away. Syndromes and all. So these 2 names are very important for you. They'll ask you. Both the names. But if you ask me, why do we have these 2? No function. They're useless. बेकार की चीज भी आपके लिए काम की है. सोच के देखो. Functions, they are useless. They do no function. But for you, it is important because they ask you the exam. So you have to remember it. The next 2 are not fancy names, glands and hair cells. They are not fancy names. But they are important because they have a very important function. They have a very important function. And what is the function? The function is protection. They are for protection of the canal, and that's why these 2 are important, because they are for protection of the canal. It protects your canal from who? From the dust and the pathogen that goes from the canal. Canal is always open. It's open. So the air goes inside, so dust particle goes in, the pathogens goes in, and therefore we need a lot of protection. And the question they ask you is, how do these 2 glands protect? Or which are these 2 glands first? One is sebaceous gland, and the other is apocrine gland. So this is the first thing. You'll have to remember the names of these 2 glands. And since they are glands, they will have the secretions. Glands have the secretion. So which gland secretes what is the next thing. Sebaceous gland, the name will tell you, is sebum. It secretes sebum. And the apocrine gland secretes what is called cerumen. Sebum and cerumen are the 2 secretions inside your canal. And they are natural secretions. They are always present in the canal. So remember this 2 names. Who secretes what? And it's easy to remember. Sebum matches with sebaceous, so it's easy to remember. The other one is apoptotic gland. That's how you remember. And these two secretions, they have antiseptic properties. That's how they put it. Antiseptic. So these two are always there. If I use this page, sebum plus cerumen are always present in the canal. And they are mainly made up of fat and they have antiseptic property. They are mainly made up of fat and they have antiseptic property. Now, canal will also have dust because it is open. Darwaza khula hua, the dust aata hi andar. The canal will always have some dust. You can't avoid that. And what is the lining of the canal? Skin. Ideally, skin is constantly, like rest of the body also has skin. And one thing about skin that we all know is that skin is constantly recycling. You know, old skin dies and the new keeps coming. It happens throughout the life. Therefore, wherever you have skin, you will have dead skin. Because the skin dies and the new comes. That's why you need to shower. Why do you scrub? And then scrubbing. What do you scrub off? It's the dead skin. What is dandruff? Either dead skin or fungus infection of the dead skin. Right? So canal will also have dead skin. Always. There's always a dead skin in the canal. And dead skin can be called keratin. Keratin. So point is, these four things are naturally present in the canal all the time. Sebum, cerumen, dust, and keratin, which is dead skin. They are naturally present in the canal all the time. But they're not supposed to accumulate. They're not supposed to collect. So they are getting formed and they are coming out all the time. It's like cleaning. The plant is getting cleaned all the time. But due to some reason, due to some defect, if these four things they mix and accumulate in the canal, then it becomes what is called the ear wax. This is called the ear wax. And this is a very important MCQ. MCQ, what is the content of the ear wax? So ear wax has four things: sebum, cerumen, dust particles, and keratin. Remember this. If I put the question differently, what does ear wax mainly comprise of? Fat, protein, carbohydrates, minerals. Fat. You can see there, it's mainly fat. Right. So when somebody comes with a ear wax, what do? You have to clean the canal, you have to pull out the wax, yes or no? If somebody has a wax and he comes to you, you have to pull out. How do you pull out the wax? How do you remove the wax? A method called syringing. So syringing is a method used for cleaning the canal of ear wax or anything, for body and all. You know what is syringing? What is the meaning of syringing? What does it do? Basically, it is flushing the canal with water. You flush the canal. The water goes inside, then it hits the membrane and it comes back. So when the water is coming back, it brings out everything along with it, whatever is inside. Tsunami, tsunami, have you seen videos of tsunami? When it comes on land, water, and when the water is receding, it carries everything. Your car, your bike, your house, if you are there, you also get carried away. Yes or no? So never stay near the water body. It's very dangerous. It will carry you along with it. So same is the case. It cannot stay inside. But there are two things here. When you syringe the canal, there are two important points that you have to keep in mind. I told you syringing is like flushing the canal with water. You have to know what is the temperature of the water you use for syringing. As many bottles of pani and you can just take the water from the bottle and syringe. No. The water must have a particular temperature. And what is the temperature? Same as body temperature, which is 37 degrees, approximately 37 degrees. Why? If you use more than this temperature or less than this temperature, what will happen? Otherwise, that temperature will stimulate something. Stimulate what? Something called lateral semicircular canal. What is lateral semicircular canal? This I'll talk about when we talk about middle ear anatomy. And if you stimulate the lateral canal, what happens to the patient? Patient begins to have vertigo and nystagmus. Remember vertigo I told you just now? Just ear does the balancing. So this is imbalancing. Vertigo is like imbalancing. The body is not balanced. The head is spinning. Vertigo, the patient feels the head is spinning. So that's what chakkar aana in Hindi. And you can't afford to have this vertigo. And that's why make sure that the temperature is 37 degrees. And if you use the temperature 37, there will be no stimulation of the lateral canal, no vertigo, no nystagmus. Safe. It's very safe. The second thing you have to keep in mind when you see the canal. What is the shape of the canal? Look at the shape of the canal. It is S like this. So to make the canal straight. So how do you make the canal straight? You have to pull the pinna in its direction. The pinna is pulled upwards, backwards, and outward. So this is another very, very important MCQ. In which direction do we pull the pinna? Upwards, backwards, and outwards. And the canal becomes straight. Now the syringing will bring out the wax easily. So there are two things about syringing you have to remember: A, the temperature, and the direction. Very simple, but very, very important. And tell me, why is syringing done? What for? To bring out anything from the canal. Anything. Wax, foreign body. It's very common in children. They'll pick up things and put in the canal. Foreign body. So you have to do syringing. But sometimes the foreign body is a living thing. A fly goes in the canal. Insect can go. In India, cockroach is very common. Cockroach. They're sleeping at night and the cockroach is crawling all around the house. It's cold, January, Delhi, and it looks a warm place. It wants a warm place, and the canal inside feels very warm for the cockroach. You crawl inside nicely and then go inside and rest nice. Wow. And when it moves, and you get that tingling sensation. Right? The canal is very sensitive. But when it moves, you get that feeling. And then you wake up. And then you rush to the hospital at 12, 1, 2. Usually the cockroach person comes at night, late night. Because when you are awake, you are not allowed the cockroach to go inside. Of course, you are aware. It only can go inside your ear when you are asleep. And you are deep asleep around 1, 2 o'clock. And suddenly you wake up and you come to the suburban hospital. ENT. And you are also sleeping. Duty doctor sleeping, ENT, there is no emergency. And then this idiot will wake you up. Sir, can't get the wax or cockroach. And you have to remove the cockroach. But if you see this patient walking in the emergency, if a person is walking in the ENT emergency at 2 o'clock at night, the movement will tell you it is cockroach in the canal. He is not walking straight. He is dancing. Almost straight. Yes, sir. The very movement will tell you this. You know the diagnosis already. You don't have to ask also. There is cockroach in the canal. You will straight away know. And I don't remove straight away. I don't do nowadays. I'm teaching enough. When I was at PG and all, I used to not remove the wax, the cockroach easily. I used to just stand like this for half an hour. I want to enjoy your dance, you know. Since I'm going to work on you, so let me have some fun at least. So stand here, have some fun, and then maybe you remove it. अगर लगे सर क्या मजाक कर रहे हो मेरे को आपको पता नहीं मेरी हालत क्या हो रखी है आपको लगता है कि मैं डांस कर रहा हूँ. Of course, we don't do that. Of course, this is a joke. I hope you get that. It's a joke. Don't do it in practice. So what do you do now? Syringing. What do you do? syringe, but never syringe when the fly is alive. First kill it and then syringe. That's very important. So when a living thing goes inside the canal, the key point to remember is you have to kill that fly, whatever is that, fly, insect, sometimes centipedes doing, that worm, centipede, millipedes, they also go inside the canal. All sorts of things. Have you read this belly? You must be reading belly. Love and belly. Love se naam aata hai. Belly bola to nahi aaya. Love bola to hai. Love and belly. Surgery food. So it says it talks about a foreign body in the rectum. Very chapter because it's a surgery. And belly says, belly is a very funny book to read. It's a very nice book to read. There's a footnotes, very hilarious footnotes of belly. I've not read it for 20 years now, but I remember. We used to sit down and read the footnote. Belly नहीं पढ़ते थे, footnotes पढ़ते थे, तो मजेदार था. उसमें rectum foreign body is nothing I have not removed from the rectum, it says. Every damn thing on the planet you find except the aeroplane, it says. I have removed from there. Same thing is here. In the ear you can remove everything. Everything. I still remember this lady who came with a child, 3-year-old child, with a grain of dal, pearls. Chane ka dal. I could see one dal. So I removed it. There was another one. I removed that. Another one. Removed that. Another one. I removed. There were 16 to 17, grains of that chane ki dal. I told her, itni dal isko bana ke khilane to peet bhi bhar jata. So she was, she was cleaning the dal and she went out and this guy, he doesn't know where to put the dal. Bole dalna beta, yummy dalna. पता नहीं कहाँ का डालते तो उसको आगे से ट्रेनिंग की उसको पता ही नहीं है आगे जाके बहुत मुश्किल होने वाली है I have to train him कहाँ का क्या डालना होता है anyways I mean it's not thrown the one it's a very same joke don't misunderstand me anyways coming back to the real thing and I've removed the leaf almost 20-25 leaves from katte. I don't know what it was just generally the child used to pick up, there was some tree in the house on the back, right around the house, used to collect the leaf and put in the canal. Next day, and it's been doing for many days. जब कान भर गया तो उसको समझ नहीं आया घर वालों की कुछ है अंदर, that's one day. And I had to put थोड़ा पेट निकल जाएगा सर, पेट निकल जाएगा. So very strange things. What I'm trying to say is very strange things can be seen in the canal. If it is an inanimate object, you just do the syringe and remove it. But if it is a living thing, you first kill it and then remove. That's the whole point. Now, how do you kill is the question. You have to put few drops of oil in the canal. Oil. That's simple. And any edible oil or hair oil that you have. Any edible oil, this mustard oil or sunflower and all this oil, or hair oil. You can put the hair oil also. Doesn't matter. So you put 2 drops of oil, it will drown and pull the fly, and then you do the syringing and remove the wax. That's what we do. Done? So if they ask me if a fly goes in the canal, what is the next thing you do? The next thing I do is put 2 drops of oil in the canal, then syringe. Okay. So this much about the canal. And then we talk about what do we have at the end of the canal? Tympanic membrane, which looks like this. This is your tympanic membrane. In tympanic membrane, what are the basic points you have to remember? The shape. The shape is described as oval. This shape is described as oval. And what is this color? Pearly white. It's described as pearly white. This is the better answer, but grey is also acceptable. Pearly white is the better answer, grey is acceptable. The third point, you are supposed to know the dimensions, length, breadth, and thickness. Length and breadth are not so important. Thickness is a very commonly asked question, so I'll only tell you thickness. Thickness is 0.1 millimeter thick. It's extremely thin structure, 0.1 millimeter. Which means that if you take 10 tympanic membranes and put them together, it only becomes 1 millimeter. 10 membranes together is 1 millimeter. So you can imagine how thin is each layer? Area. Now, when you talk about area, there are two questions: total area and effective area. So, total area is how much? 85 to 90 millimeters square is the total area. So, what do I mean by effective area? Effective area is the palm ka hai, actually the one that actually does the function. So, the whole is not useful. Only a part of it is useful. So, that effective area is 45 to 55 millimeter square. So think about, look at a large part of the tympanic membrane is useless. It is not effective. And this is not only true about tympanic membrane, this is true about most of the organs. Even kidney is functioning only at 30-40% at a time. You know, most of the kidney is not working. It's not bad, but you don't need it. 30% kidney, 30% liver is enough. We don't have to use it. But brain, we have to use it, we don't use it. It's another thing. Brain, we use only 20%, but we should use the entire brain, but most of us do not want to use it. So we are working at a 25% capacity only. If we use the entire brain, there is no reason why we will not do very well in the exam. Class में बैठे हो तो आधी टाइम तो कुछ और सोचो. You are thinking something else. So your brain is not being used. Washroom कोई गया है तो फिर three people will follow the concept. Because that's a psychology. Suddenly you realize your bladder is also pressurized. So you start feeling the pressure in the bladder, so you walk. See, one person goes and everybody will walk. And class was only 1 hour class, but still everybody was walk. Somebody who says, "Sir, please speak loudly because I can't hear you." And I'm seeing that the person is already constantly talking to the neighbor. I can see everything actually. Mr. Medicine don't let the उनसे बात करेगा, वापस में बात चल रही है. सुनना ही इनको नहीं देगा, लेकिन आवाज नहीं जाएगी तो बोलोगे सर please speak loudly. But when I see that they are constantly talking, I can see through the board also. Most of the board के पीछे छुपे हुए हैं. I can see through this. I can see everything. So as I told you, मैं पढ़ा रहा हूँ मैं. 20 years teaching, I know everything. What's going in minds, I know. The class. Anyways, coming back to the real stuff. So tympanic membrane is also not working at full capacity. It is moving, working around 60% capacity. So that is the effective area, which is 45 to 55 millimeters square. Now, if you look at this tympanic membrane, you know this boundary of the membrane. This is the boundary. What is the boundary of the tympanic membrane called? Anybody? This boundary of the membrane is called annulus. Boundary is called annulus. And what is this structure? This structure that you see? It's a bone. What bone is this? This bone is called handle of malleus. This bone is the handle of malleus. And this tip of the malleus, this tip point has a name. What is the name of this tip? I'm writing here, it's called umbo. Umbo. Umbo is the tip of the handle of malleus. And at the top, there is another bone you can see at the top of this handle of malleus. There's another thing you can see, which is this one. See, this one. This is a bone. What a bone is this? This one. This is called lateral process. Lateral process of malleus. So I'm writing the name here also. Lateral process of malleus. So in a normal tympanic membrane, these are the three other things that you can see. Handle of malleus, umbo, and the lateral process. Now, If you draw a line at the level of the lateral process, or you can say in the center of the lateral process, if I draw a line like this line divides the tympanic into two parts. The smaller upper part and below that the larger part. And these two parts have names. So what is that small upper part of the membrane called? It's called pars flaccida. And the big part, this big part is called pars tensa. Pars flaccida and pars tensa are the two parts of the tympanic. What is the meaning of the word tensa? Tensa is tight. Tense, tense is tight. And opposite is flaccid. Flaccid means loose. So if you look at the membrane, this big part looks very tight. So it's called tensa. Pars tensa, part that is tense. Pars tensa means part that is tense. And the upper part looks very loose. And so it's called part that is loose. Pars flaccida. But the question is, MCQ, that pars flaccida has one more name. And this is a very important MCQ. What is the other name for pars flaccida? Very, very, very popular question. What is it? Sharpness. It's called Sharpness membrane. Remember this. MCQ. Sharpness membrane is the other name for pars flaccida. And please be mindful of the spelling pars sharpness. It's not sharp, it's sharp, R-A-P. It's not S-H-A, it is such as R, S-H-R. Okay. So if you have written S-H-A-R-P, please correct that. Sharpness membrane. Sharp, sharp, that's how sharp. That's how you pronounce it. Sharpness membrane. So, the last thing you have to know on the membrane, this part of the membrane, there is a cone-shaped area which is very bright. Cone-shaped area which is very, very bright, as if light is coming from this cone-shaped area. And that's why this area is called cone of light. Cone of light. Cone of light. I'll show you another image of the tympanic membrane. This time it is a diagram drawn. This is an actual image, this one. I'll show you a diagram of the tympanic membrane and we'll try to identify the structures that we have talked about. Let's see. And it's very easy. So this is that image. So you will name, I'll just mark and you will name. What is this? Annulus. What is this? Annulus alias. Escape umbo. This bone that you see, that will process. What is this? Cone of light. And this part is called pars flaccida. And rest of it is pars tensa. Very easy. Right? So this is what we have to know in the tympanic membrane anatomy. This also comprises the external ear. Remember, external ear is pinna canal and the outer surface of the tympanic membrane. In the last thing we talk about the external ear, anatomy is the nerve supply. Nerve. How many nerves in the external ear? 5 nerves. The external ear has 5 nerves. How many choices do you get in a question? 4. That's why anywhere if there is more than 3 names, becomes a logical MCQ. So we have 4 names, 5 names, 6 names. It is any more than 3. 3, 4, 5. Like 3, the 3 names will ask which is not true for this. So 3 plus will give something else. So here we have 5 limbs as I said, so it is important. So I will draw the diagram. Inner, canal, tympanic membrane, middle ear, and inner ear. We'll do the nerve supply of all the ear, every part. So in one diagram, we'll have all the nerves of the ear, so you can revise and remember easily. And externally, I can how many nerves? 5. 1, 2, 3, 4, 5. 5 nerves. And what is one of the things you can remember so that it becomes easy to remember is the first 3 start with the letter A. We all start with the letter A. So A, if you can remember that, it becomes easier. And out of the next 2, one is greater and one is lesser. So that's how we remember. The first A stands for auriculotemporal nerve. And this is a branch of trigeminal, 5th cranial nerve. 5th nerve. Okay, remember this name. Auriculotemporal is a branch of 5th nerve, trigeminal. But the next nerve is the most important nerve of the external ear. Which is the next one? Arnold's. It's a branch of vagus, 10th nerve. It's a branch of 10th nerve, vagus. And the third is auricular branch of 7th nerve. So these are the 3 nerves starting with the letter A. So easy to remember. And they are coming from the cranial nerves 5th, 10th, and 7th. And the next 2 is also not difficult because one is greater, one is lesser. Greater, auricular, and lesser, occipital. That's how you remember the 5 nerves. So let me ask you, which are the following cranial nerve does not supply? There are 3 cranial nerves, cranial, 5th, 7th, and 10th. So we can ask you, which are the following cranial nerve does not supply the external ear. So they can be like 5th, 7th, 9th, 10th. If I tell you the following cranial nerve, 9th is not there. See, that's how you get the answer. Okay, 9th will not supply the external ear, but 9th will supply the middle ear. 9th nerve is the nerve of the middle ear. So now we are doing the nerve of the middle ear. The branch of the 9th that goes to the middle ear is called Jacobson's. Now this name is again an important name. Jacobson's nerve is a branch of the 9th nerve that is going to the middle ear to the floor. It's going from the below. And after entering the middle ear, it forms a plexus called tympanic plexus. Tympanic plexus. And ultimately, it is this tympanic plexus that will supply everything, all the walls of the middle ear. Therefore, if I ask you which nerve supplies the middle ear, what do you see? You can say any other 3. You can say tympanic plexus, you can say Jacobson's, you can say 9. All 3 are same thing. It's same. So now you know the nerve of the middle ear also. It's easy now. And inner ear, what is the nerve you already know? What is the nerve of the inner ear? A nerve that comes from here. 8th nerve. Remember this 8th nerve? So inner ear is the vestibulocochlear nerve. 8th nerve. Vestibulocochlear. So this one diagram will show you all the nerves of every part of the ear. So it's very easy for last moment revision. So please draw this diagram, write this name. It's quite useful. And this is complete middle external ear anatomy. The next thing you're going to do is the middle ear anatomy. And I already told you that middle ear is the most important part of the ear. Most important. So we are talking about the most important anatomy that is likely to be asked in the exam. If they ask you an anatomy question, it is going to be the middle ear anatomy 9 out of 10 times. So the first thing is, what is the shape of middle ear? Shape of middle ear is, it's like a matchbox. Middle ear is defined of a shape of a matchbox, or simply box. How many boundaries a box has? 6 boundaries. This room is like a box. This room is also box shape. Yes or no? There is one boundary here, 1, 2, there is below, floor, that is outer boundary, 3rd, this inner boundary, 4th, this entire boundary, 5th, this posterior boundary, 6. So middle is like this box, 6 boundaries. That's why whenever I draw the middle ear, I draw it like this. Like a box. This is how we draw the box, isn't it? Box ऐसे बनाते हैं. So this is like the middle ear, like a box. 6 boundaries. And this box-like middle ear is divided into compartments by drawing 2 lines. If I draw 1 line here and 1 line here, how many compartments we have? 3 compartments. This is upper compartment, this is middle compartment, this is lower compartment. 3 compartments: upper, middle, lower. Okay. 6 boundaries, 3 compartments. And what is the main content of the middle ear? What is the main thing inside the middle ear? Ossicles. How many ossicles? 3 ossicles. What are they called? Malleus, incus, stapes. Malleus. The ossicles look like this. This is malleus, the first ossicle. This is incus, the second ossicle, and this is stapes, the 3rd ossicle. And this point is called the foot plate of stapes. This is a part of the stapes. Foot plate of the stapes is a part of stapes. So this is how they. And what is this blue thing? This is tympanic membrane. TM stands for tympanic membrane. So this is your ossicular chain. We call it ossicular chain. It's a chain made up of 3 ossicles. They join together and they form the chain. And this is the main thing inside the middle. Right? Now, if you have 3 ossicles, which are bones, how many joints do you expect? 2. 2 joints. 3 ossicles will have 2 joints. 1 joint is this one. See, this is a joint between the 2 ossicles, and 1 joint is this one between these 2 ossicles. 2 joints. The first joint is between who and who? Incus and malleus. Am I right? Therefore, this joint is called incudo-malleolar joint. Incudo-malleolar joint. Pretty logical, isn't it? Now you give the name to the other joint. If you are allowed to give the name to the other one, what do you name it? How do you name it? Incudo-stapedial. Incudo-stapedial. Now from the name you understand that the first one is between incus and the malleus, the second is incus and the stapes, isn't it? Now from the orthopedics, you must be knowing that there are many types of joints. So all the joints in the body, you must know which joint is one type. The same question here. What type of joint is the inferior joint? And what type of joint is the inferior joint? So what is the inferior joint type? Saddle joint. The saddle type of joint. And what type of joint is the inferior joint? It's called ball and socket. And this is extremely important in MCQ. This ball and socket is an extremely important question. So please remember this. And the last thing about the ossicles is the function. Why do we have the ossicles in the first place? Why did nature make ossicles? If you believe in God, why did God make these ossicles? Well, hearing, but what does it do? Amplification. Amplification of the sound. Correct. The function of the ossicles is actually ossicle plus middle ear. Pura middle ear plus middle ear, as you are rightly saying, is for amplification of sound. And we all know the meaning of amplification, to make the sound louder, so that you can hear better. So this is the function of ear, middle ear, amplification along with ossicles. Now if I ask what is the function of the middle ear and ossicles, if you say amplification, it is the correct answer. But there is a better term for the same thing. What is the better term which is actually asked in the exam? What does that mean? This is the same meaning. Impedance matching, correct. Impedance matching. This is the right word. This is the right word. Okay? Impedance matching. But you can say amplification to wish. Asan. Both are correct. One is more proper. If you introduce your dad to somebody, and say, he's my dad, my papa, my father, you never say, my baba. You never say that. But it's not wrong. You say, my baba, it's okay. But it's not proper. It will sound good. So that's the thing. You say it's okay, but that's not the right way to say it. It's an impedance matching. Okay. Then we talk about the compartment. How many compartments? 3. And they have names. The upper compartment is called rapid tympanum. Middle compartment is called mesotympanum, and lower one is called hypotympanum. So very easy. Rapid tympanum, mesotympanum, hypotympanum are the 3 compartments. Epitympanum is one more name. What is the other name for epitympanum? Attic. So this name is also very important. Attic. You must know what attic means. So we know the ossicles, we know the compartments, and now we have to talk about boundaries. How many? 6 boundaries. So you have to draw another box. Okay, you have to draw another box. I will not draw, I will just use the same. I will remove instead all this. So draw another diagram of this type. Draw one more diagram. So that you will start talking about boundaries of the middle ear. Now, into this middle ear, if I add the external ear and the inner ear, if I draw the canal here and pinna and See, this is the first diagram that I drawn, the line diagram which I said. It's the same thing. The only difference is middle is like a box in this diagram. Isn't it? Now, why I draw the external middle ear and inner ear together? So you can name the boundaries. So if I ask you what boundary is this, what do you say? It is the outer boundary. It is facing outwards. This is the outer boundary, also called the lateral boundary. And let me remove this cochlea. So tell me, what is this boundary? This is inner bound. It is towards the inner ear, also called medial bound. What boundary is this? Superior boundary. This is roof. So what is this? Floor. Inferior boundary. Floor. This is anterior boundary. This is anterior boundary. The whole. And behind this is a posterior boundary. Behind is a posterior boundary. So we know what are the 6 boundaries. We have outer, inner, roof, floor, anterior, posterior boundary. Now, out of the 6 boundaries, one boundary we have already discussed. Which one? The outer bound. Outer bound is supposed to be what? Tympanic membrane. Because tympanic membrane is like a border between the external and internal ear, so it is common to go. So this boundary is supposed to be like this. So the angle of Malleus, remember? Lateral process, cone of light. This is your tympanic membrane that we just discussed a little while ago. It's a common boundary between the external ear and the outer boundary. So one boundary you know already. You don't have to discuss this. This is same as this diagram. This is this. Okay. Now, second thing you have to know is that the inner boundary is not straight like this. It's not straight like this. The inner boundary has a mild bulge like this. It's bulge. It's not straight. It's bulging. And this bulge has a name. And the name of the bulge is promontory. The name of the bulge is promontory. So this name is important, promontory. It's a bulge on the medial wall of the brain. But why do you have this promontory is the question. Something has to fit behind this. It is creating a space here. There is a space here extra because something will have to fit here. What is that something? What is this? What is this whole thing called? Cochlea. And this part of the cochlea is called base of cochlea. Base of cochlea. promontory को बेस पसंद है. promontory को कौन पसंद है? बेस पसंद है. Right? So why do we have promontory? For the base of to adjust the base of the coupling. That's why we have the promontory. What is this point of the? What is this point called? This is apex point of the coupling. Coupling has 2 points: base, 2 ends, base end and the apex end. Then roof. Roof has a name. What is the name of the roof of the ear? This is a very popular MCQ. It's called tegmen tympani. Now this is a very important MCQ. Remember this. Very, very popular question. Tegmen tympani is the name of the roof of the ear. What it is about this tegmen tympani? Below is the ear, middle ear. What is about this? Brain. About this is the brain. Which part of the brain? Which lobe of the brain? Which bone is this? Temporal bone. Remember? So the brain part is called temporal lobe of the brain. If you go above the tegmen tympani, on this sitting is the temporal lobe of the brain. So if I ask you, tegmen tympani separates who from who? It separates the temporal bone of the temporal lobe of the brain with middle ear. One side is middle ear, one side is temporal lobe. So it's very easy. Right. So this is about roof. Floor. Below the floor, there are 2 things. And one you know already. That nerve. Which nerve? Ninth nerve. A branch called Jacobson's. Yes or no? It enters to become a plexus. What plexus? Tympanic plexus. So this comes from the floor. You know this already. Ninth nerve you can say. But there is one more thing. There is a vein here. Which vein? Jugular vein. So below the floor, we have 2 structures. One is the ninth nerve, which is branch that Jacobson's and all that, and a vein called the jugular vein. So how many boundary done? 4. Outer done, inner done, roof done, floor done. So what is that? Anterior, posterior. So we'll talk about these 2 boundaries now. The anterior boundary and the posterior boundary of the middle. So now we are coming to the most important thing that you have to know in the middle. Our next diagram is going to the most important diagram of the day. The next diagram is going to be the most important diagram of the day. Middle ear. How many boundaries? 6 boundaries. Now, if I examine the ear from outside, if I'm looking in the ear from outside, what do you see? You can see the tympanic membrane. Which boundary of the middle ear? Outer boundary. This is outer boundary, lateral boundary. Out of 6, you can only see 1. Rest of the 5 are hidden. Just imagine, this is imagination, that you remove the tympanic membrane. You remove this boundary. Now what do you see? You can see the inner boundary and the boundary. You can see the inner boundary and the boundary. So you are looking, suppose this is the outer boundary and this is the inner boundary. So when you see from outside, you can see this boundary. You can't see this boundary. But if you remove this, you can see this boundary. And there's a roof like this. There's a floor below. There's one boundary, anterior boundary, posterior boundary here. There's anterior boundary like this. Isn't it? So imagine you open this wall, you open this wall, you open this wall, open this wall. You open them up. So basically you had a box with 6 boundaries. Remove one boundary. And you have opened it. So you have 6 boundary box. You remove one boundary and you open it up. So how do you draw the open box? Can I draw it like this? Don't draw it. Don't draw it. This is your roof. This is the floor. This interior wall. This posterior wall, and this is medial wall. Isn't it? Now, as I said, this is the most important diagram of the day. And you have to write a lot of things around this. Lot of things. So what you do is draw this diagram in the center of a fresh page. Don't draw in the already used page. Take a new page and draw in the center and draw a small diagram because you need more space to write. If you draw a big diagram, then the diagram will occupy the space. And preferably in the landscape format. Turn your book in the landscape format. On the sides, you have to write a lot of things. So I'll draw this again while you're drawing. I'll draw a better diagram. What's the roof called? Roof is called Edwin Infinite. And there is a bulge on the medial wall. What is the bulge called? Promontory. In the center. So if I draw the promontory, it comes about like this. Let's say this is a promontory. It's a bulge. So I'm going to remove these names that I've written. We'll start with anterior wall. Let's talk about the anterior wall of the middle ear. Now, anterior wall is important because it has two openings. One is a small opening, one is a large opening. The upper opening is a small opening, which is like this. And below that is a large opening, like this. So these are two important things on the anterior wall, the two openings, a small and a large. The small opening is called canal for tensor tympani muscle. And from the name you understand the function of this canal. What do you understand from the name? A muscle is there which is coming in through the canal in the ear. What is the name of the muscle? Tensor. So remember this muscle in the middle ear is called tensor. Just remember that name. So now I say, where is the tensor tympani? What is the name of the middle ear? Remember? Tympana. Remember that? Tympana. So tympana means tympana, middle ear, so that's very logical. But the bigger opening which everybody knows is eustachian tube. Eustachian tube opening. Right. Two things on the anterior wall. Like I said, tensor tympani, you just remember the name of the muscle that's substance. But eustachian tube is very important. There are 6 to 7 MCQs from the session. 6 to 7 MCQs on one tube, which is eustachian tube. So we'll have to talk about this tube in a little more details. But we know that it's a tube of the name. So tube is like this. It's a tube. And any tube has two ends. This tube also has two ends. One end of the tube opens in the middle ear. We know this, anterior of the middle ear. Where does the other end of the tube open? On the lateral wall of nasopharynx. Lateral wall of nasopharynx. This is where the other end of the tube opens in the lateral wall of the nasopharynx. Therefore, if I ask you, station tube connects who with who? What do you say? Station tube connects the middle ear to the nasopharynx. It connects the middle ear to the nasopharynx. Very logical. But where is nasopharynx? Where is nasopharynx? Pharynx behind the nose is naso. Naso is nose. Pharynx behind the nose is nasopharynx. Now, when we draw the pharynx, which we'll do later in our lectures, when we draw the pharynx, this whole thing is a pharynx. This whole thing is a pharynx. And this part of the pharynx, the top part, which is behind the nose, this pharynx is behind the nose, is called the nasopharynx. This is a nasopharynx. But we don't have to draw this now because we discuss this when it is, this is throat, so it will be drawn there, so don't worry. But when I draw the station tube here, this is your station tube opening, like this. So this is the other end of the tube is this. One end is in the middle ear, the other end is here in the behind the nose, you can remember. Right. So this end is this end, this one. And this end has a muscle attached here. Which muscle? The muscle is called tensor velli palatini. There is a muscle here called tensor velli palatini. And from the name of this muscle, what do you understand? It's a muscle of which part of the body? Palatini, palatal muscle. It's a muscle of the soft palate. So your soft palate muscle is also attached to the station. But why is it important here? That because of this muscle, this end of the tube has a bulge like this. The muscle is here actually. There's a bulge. In other words, if you look at this diagram, then there is a bulge here. There is a bulge here. Why is this bulge? Because of the muscle. Which muscle? Tensor velli palatini. This bulge has a name. That's why it is important. And see, what is the name of this bulge? It's called torus tuberix. The name of the bulge is torus tuberix. If I ask you who forms the torus tuberix, what do you say? The part, the station tube and the muscle. Which muscle? Tensor velli palatini. So once again, this is torus tuberix. But let us know the less important part of the station tube, like length. They ask you the length. The length is 36 millimeters. This is a very important question. The length is very important. How much is the length of the canal, this external canal? 24. 12 into 2. This is 12 into 3. That's how I used to remember. 12 into 2 is this one, 12 into 3 is this one. Canal is made up of what? Cartilage and bone. Which is cartilage, which is bone? Outer 1/3 is cartilage and inner 2/3 is bone. This is opposite. This is opposite. Outer 1/3 is bone and inner 2/3 is cartilage. See, you can prepare some beautiful question now. They'll ask you whether the following is true. And outer 1/3 of the canal is bony, inner 2/3 of the canal is bony, outer 1/3 of the canal tube is cartilage, inner 2/3 of the tube is cartilage. This is how they can frame a question, and they can have so many permutations and combinations possible. So if I ask whether the following is true, okay, which is true? Outer 1/3 of canal is bone. Second, outer 2/3 of canal is bone. Outer 2/3 of eustachian tube is bone, and inner 2/3 of tube is bone. So which is true? A, B, C, D. Which one? A is true, isn't it? So this is how they can frame. They can talk about cartilage. They can, So there are so many possible questions on the same thing, and it's very easy to get confused in the class, in the exam. Because in the exam you are already slightly anxious and nervous. We all know. So that's why these things they look simple now, but they can be very, very problematic in the exam. So you have to remember these things thoroughly. Right. Then, what is the function of the tube? Why do we have the tube in the first place? Function. Eustachian tube has two main functions. One is to balance the pressure of the middle ear. And the other is drainage of secretions from middle ear. So whatever is there in the middle ear, that thing comes out of the eustachian tube. So drainage is the function. Balance the pressure and drainage of secretions. To balance the pressure, the air has to go inside. So air enters the tube in the middle ear to balance the pressure. And the fluid of the ear is coming out of the tube for drainage. It comes out all the time. So drainage. So something is going in and something is coming out in the tube all the time. What is moving inwards? The air. What is moving outwards? The fluid, secretion. But whatever, if something has to move in and out of a tube, that tube has to be opened, isn't it? You understand this? So eustachian tube is only useful when it is open. But sometimes due to some disease, the tube gets blocked here. It closes. So this end of the tube actually, this end, it closes. It is blocked here. Blocked tube. And you understand, if your tube gets blocked, both the functions cannot happen. It cannot balance the pressure, it can drain the secretion. The air cannot go inside and the fluid cannot come out. If the air cannot go inside, this causes negative pressure in the middle ear. Air is not going inside, so there is negative pressure. And the negative pressure causes two things. One is called barotrauma, and second is called retraction of tympanic membrane. These are two things that will happen if a eustachian tube gets blocked: barotrauma and retraction. Similarly, if there is no drainage, the fluid is not coming out, so the fluid will start collecting. So there is collection of fluid now. And collection of fluid leads to what is called otitis media. The situation is called otitis media. What does otitis media mean? Otitis media means infection of the middle ear. Middle ear infection. So the point is, if a station tube is blocked, it can lead to 3 problems. What are the 3 problems? The first problem is that the computer, the laptop has hung again. That is the first problem. And the second problem is, of course, barotrauma. The third is retraction. I mean, first is barotrauma, second is retraction, and third is otitis media. Now, otitis media is a very, very important topic. It's a very big topic actually. And it takes a lot of time to discuss otitis media. So that we'll do later on, not today, tomorrow, in details. We'll discuss that in details tomorrow. But these two I'll tell you now, barotrauma and retraction of the tympanic. What is barotrauma mean? Baro means what? Pressure. So trauma due to sudden change of pressure is called barotrauma. Trauma due to sudden change of pressure is called barotrauma. When do you usually experience barotrauma? In the flights. We have all experienced barotrauma some point in our life while flying. Suddenly your ear gets blocked, isn't it? That's barotrauma. barotrauma समझा रहे हैं क्या? अच्छा, इसको पता नहीं. फ्लाइट में नहीं बैठे बेटा? फ्लाइट में नहीं बैठे? और बस यहाँ बैठे तो फ्लाइट में जरूर बैठे. ये तो चाइना से या तो रशिया से. क्या लोग बता नहीं सकते? Okay, barotrauma हुआ तो कभी? You ever experienced barotrauma? The ear gets blocked, but you don't worry, isn't it? Because in a few minutes, the tube will open up and your balancing will happen and the ear becomes normal again. But the question they ask you is, barotrauma is more common when you are taking off, ascending, or when you are coming down, descending. And the answer is descending. Barotrauma is more common when you are coming down or descending. What is retraction of tympanic membrane? I have no choice but to restart the system. I tried all possible means. It's not working. The only option I have left with is I have to restart. Retraction. Retraction. When the station tube gets blocked, then either there is a problem in the drainage or in the drainage of a balancing of the pressure. And when there is a problem in the drainage, it causes otitis media. If it is a balancing problem, it is either barotrauma or retraction of the tympanic membrane. Now, for explaining the retraction, I will use this diagram. Somebody has made this on the screen and I cannot remove this. इससे बढ़ाया हुआ कर सकता है. This is चांद पे दाग. And nobody can remove the चांद पे दाग. लोग कहते हैं सुंदर लगता है, मेरे को सुंदर नहीं लगता. I certainly not this one. It's very disturbing too. Okay. Now, the tympanic membrane is here, right? And we all know That tympanic membrane is touching the first ossicle. What is the first ossicle? Malleus. So if I draw the malleus, this is the malleus. This is the incus. Somebody who has done this, please remove it. Guys, online guys. And this is the stapes. So, like this is the second ossicle, malleus. This is the third ossicle, stapes. Second ossicle, incus, and this is the first ossicle, malleus. So, tympanic membrane is only touching the malleus, as you understand. And the middle ear pressure is balanced by the station tube. So, the station tube gets blocked. We all know the middle ear becomes negative pressure. This I told you. What does negative pressure do? It pulls. So the tympanic membrane gets pulled in and it begins to come here. It shifts from here to here because of the negative pressure, it gets pulled down. This is called retraction of tympanic membrane, or simply retraction. So retraction is when the tympanic membrane is getting pulled inwards. But if you don't treat the problem, and if the station tube remains blocked for many more days, there will be more negative pressure in the middle ear and there will be more retraction. So the tympanic membrane from here will get shifted more and come here like this. See, it has come here. This is more severe retraction. Still, if you don't treat and it remains like that for many more days, you get more retraction, it will come here like this, from here to here. You know? So it keeps getting pulled inside more and more and more. So that's why retraction has grades. Grade 1, grade 2, grade 3, and grade 4. There are 4 grades of tympanic membrane retraction. So you can imagine that the first one is grade 1, the second one is grade 2, the third one is grade 3, like that. And this is the meaning of retraction of tympanic membrane. This lady in the yellow, whatever, orange top. Bolo, wait karu, thoda sa. Seriously, I can wait. It is so important. When the mind is free without fear and the head is held high, you know, mind is without fear and the head is. When the mind is free, only then you can study, otherwise you cannot study. So if something is bothering you, it's useless teaching. You can't concentrate. It's the most difficult thing to do is to study, isn't it? So study is only when you are free of anything. So if you have something to write, comment to somebody, please do. Go ahead. Seriously, it's not a thing. Seriously, send a message to Dalo. Not now, he in the class. Dalo, please. Mommy, Papa, friend. Sure. Okay. So please raise your hand next time. If it's very urgent, you have to, post something, comment on a WhatsApp or whatever to somebody. Raise your hand, sir, 1 minute. I'll wait 1 minute. Seriously, I'll do that. And then you can post so that once it is done, you are free. Then you can concentrate, right? Okay. Now, what you have to know, you know what is retraction now, right? Now, what you have to know in retraction are 2 things. Who gave us the grading of retraction to 4 grades? The name of the person is very, very, very important. Yeah. And second thing is what happens in grade 1, what happens in grade 2, what happens in grade 3. Ideally, you are supposed to know all 4, but I'll tell you only one, the most important that you have to remember, which is grade 2. Okay. So first thing, who gave us the grading of retraction to 4 grades? And many of you know the name. The person is SADE. 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 Sade is the name of the person who gave us the grading in 4 grades. And the second thing is, what is grade 1? What is grade 2? What is grade 2? Normally, is the tympanic membrane touching the incus? The answer is no. It is not touching the incus. So if it starts touching the incus, and main investigation required is tympanometry. Tympanometry is the main investigation of station 2. So this will complete everything to do about station 2 and the lateral wall and the anterior wall. So The next wall is the medial wall. Retraction, क्या? Grade 2 retraction is when the tympanic membrane touches incus but not the promontory. That means it has gone up to the incus but has not managed to go up to the promontory. That is grade 2. If it goes to the promontory, it becomes grade 3. Promontory is grade 3. But that's not important. They don't ask for this one. Okay? Promontory. Remember promontory? That bulge on the medial wall. What is the cause of the promontory? Base of cochlea. Promontory is due to base of cochlea. So I'll draw another diagram, similar diagram. And there is a promontory here. Yes or no? So now we'll discuss medial wall of the middle ear. Medial wall of middle ear. Please mute your phones. Guys, please mute. I can hear your mom speaking to you, shouting at you. Please mute. मेरे घर के सारे भेद पता चल रहा है मेरे को. Correct. Okay, 2 bulbs, 2 windows, and 2 more things on the medial wall. 2 bulbs, 2 windows, and 2 more things on the medial wall. So 2, 2, 2, very important, easy to remember. 1 bulge you know, promontory. The other bulge is bulge of lateral semicircular canal. This is the other opening, which is a bulge of lateral semicircular canal. Remember this name? Syringe. If you use different temperature of water, then this gets stimulated and the patient begins to have vertigo and nystagmus. And this is present in the top corner of the medial wall, here. This is your bulge of the lateral semicircular canal, this the top corner. So you know already that we should not stimulate this. If you stimulate this, the patient will have vertigo and nystagmus. Then there are 2 windows. One is above the promontory here, this window. One is below here. Because the shape, I deliberately drawn the shape like this. The upper one is oval in shape, is called oval window. And the lower one is round in shape, and so it's called round window. The name is because of the shape. And remember, the upper one is oval in shape, the lower one is round in shape. Now, the round window, the lower one, is covered with a membrane. And they ask you what membrane is this. Round window has a membrane called secondary tympanic membrane. Now this is a very important MCQ. The fact that round window is covered by a secondary tympanic membrane is a very popular MCQ. Try and remember this. 2 more things. One is facial nerve. 7th nerve. Where is 7th nerve? It is just above the promontory. So if I draw the 7th nerve like this, and then it goes down and goes out of the ear. This is your 7th nerve. So as you can see, your 7th nerve is present on the medial wall of the middle ear, but it goes to the posterior wall also, and then it goes down. We'll discuss the posterior wall and the 7th nerve again. But what is the second important thing on the posterior wall, on the middle wall? Is a fistula called fistula antefenestrum. This is the other thing you have to know, something called fistula antefenestrum. Where exactly is the fistula antefenestrum? Can you see the oval window? Upper window? Just in front of them. Here. This is your fistula antefenestrum. Right? What is the importance of fistula antefenestrum? Fistula antefenestrum is important because it is the most common site of autosclerosis. It is the most common site of a disease called autosclerosis. Autosclerosis is a very popular disease of ENT. We'll discuss this disease in details maybe tomorrow. And one thing you already know, where does it arise most commonly from? It arises from the fistula. Remember this, I'll ask you tomorrow. Okay. Where does autosclerosis start from? It starts from fistula, in front of the oval window. Right. So this completes the medial wall, very easy to remember. And the last wall is the posterior wall of the middle ear. I'll draw the posterior wall, one more diagram. Posterior wall of middle ear. The last one. On the posterior wall of the middle ear, one thing that you already know, look at the diagram and tell me, one thing that you already know is a facial nerve. You see the facial nerve of the posterior is going down and it's coming out of the ear. So if it is coming out of the ear, there must be a foramen here. And this foramen, through the facial nerve comes out, has a name. What is the name? Stylomastoid foramen. Now this is MCQ. The last one, name the foramen through which the facial nerve comes out of the ear. Stylomastoid foramen. Which is on the lower end of the posterior wall, as you can see. So lower end of the middle ear posterior wall has the foramen, and the upper end has a door. There is a door here, and this door has a name. What is the name of this door? Adytus. Door is called adytus. The word door means, adytus means door. You know, the literal meaning of adytus is door. And now comes the three most important names from the posterior wall. Three most important. One is pyramid. The other is facial recess. And the third is sinus tympanum. These three are the most important names from the posterior wall of the middle ear that you need to remember. Pyramid, facial recess, and sinus. What is pyramid? Pyramid is a small bony projection from the posterior wall. A small bone is there on the posterior wall. That bone is called pyramid. And you must have guessed it. Why is this bone called pyramid? Because the shape is like a pyramid. The shape is like a pyramid. But where on the posterior wall exactly? Can you see the facial nerve turning? Just below the turn of the facial nerve. Here, like this. This bone that I am drawing, this is a pyramid. It's a very small one actually. But why is pyramid so important?
Pyramid is important because a muscle arises from here. Which muscle? Stapedius. Pyramid gives origin to the muscle called stapedius muscle. That's why pyramid is important. Which is the other muscle we discussed in the middle here? इसके अलावा what is the other muscle? Tensor tympani. Tensor tympani comes from the canal called canal of tensor tympani. So, and there is one more muscle, stapedius. Two muscles. Which is more important for you? This one. This is very, 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 very important. We'll talk about this. But let me first tell you the other two names: facial recess and sinus tympani. Facial recess is FS, FR, and sinus tympani ST. So this area is called facial recess, FR, and this is ST, sinus tympani. Facial recess is on that side of the facial nerve, and sinus tympani is on this side of the facial. Now they ask you, what is the importance of sinus tympani? Sinus tympani is important because recurrence of disease is very common. In sinus tympani, the recurrence of disease is very common. And you know what is recurrence? What is recurrence? If you remove the disease, do the surgery, remove the disease, it comes back again. Again it will happen. Why? The question is why? Why is recurrence so common here? Because it is difficult to do surgery here. Difficult to operate here. So you can't do a surgery properly here. And that's why the disease is never completely removed. It remains always. And so it comes back again. So that's the reason. So they ask which is the most difficult area to operate in middle ear. The answer is sinus tympani is the most difficult area to operate. So these are the few names. If start from the top, there is aditus, there is a facial nerve, then there is stylomastoid foramen. On the medial side, there is sinus tympani, the most difficult area. On the other side, there is facial recess and the small bony portion called pyramid with the stapedius muscle originating. And I told you, out of all these things, this muscle is the most important thing. And there are 4 or 5 very, very important MCQs about this muscle. So let's talk about the stapedius muscle. Like most of the muscles of the body, here also you have to know 4 things. You have to know the origin, insertion, nerve supply, and function. Bas, that's all. And that's what you have to know. You know one already. Origin. Where is the origin from? Pyramid. Which wall? Which wall? Posterior wall. Remember this. Where is the insertion? Neck of stapes. Stapes basically. Third ossicle. See where it got its name from? Now you understand why the name is stapedius? Because of this. Nerve supply is very easy. You can guess. 7th nerve. Because in the neighborhood there is a nerve, 7th nerve, close by. If I use this diagram, from here a branch arises and supplies here. 7th nerve branch. Function. This is the most important thing. Why do we have the stapedius muscle in the first place? The function is to dampen the loud sound. This is very important point. The muscle is for dampening of the loud sound is a very popular MCQ. Remember this. What is the meaning of this word damping? To reduce the loudness of the sound. It will reduce the loudness of the sound, and that's why it's called to dampen the loud sound. What is the function of the middle ear? And the ossicles? Amplification. What is the right word for that? Impedance matching. It is making the sound louder, increasing. And in the same medial there is a muscle, it is doing the opposite thing. It is decreasing, the dampening. Right? So what is the difference? If one is increasing, why is the other decreasing? Then the net result is 0, isn't it? Think about this. If I take this bottle up and you pull it downwards, then the net result is 0, it's same place. So what is the difference? Why is dampening and amplification happening at the same time? Correct. He's absolutely right. He says, whereas every sound that passes through the middle ear is amplified, everything. Only the very loud sound is dampened. So it dampens the loud sound only. Normal sound will not dampen. Because loud sound can damage your inner ear, cochlea. If the sound is too loud, your cochlea can be gone forever. And that's why it makes it less loud. So in simple word, it is protecting your cochlea. It's a protection. How does it do this? How does it dampen? By producing a reflex called stapedial reflex, which is also called the acoustic reflex. Same thing. Okay, so remember this name reflex. The stapedial reflex or acoustic reflex is produced by this muscle, and this reflex will dampen the loud sound. So all connected names, because it is inserted in the stapes, the name is stapedius muscle, and because it is producing a reflex, this is called the stapedial reflex because of the muscle. So all these names are related. Now about reflex, you would know, I'm sure. A good thing about reflex is that every reflex will have at least one afferent nerve and one efferent nerve. So this reflex also has one afferent nerve and one efferent. And this is what they ask you, that which is the afferent nerve in the stapedial reflex and which is the efferent nerve in the stapedial. Anybody who knows the answer? Afferent nerve is the 8th nerve and the efferent nerve is the 7th, the facial. So now if I ask you, tell me how many things I need for a normal stapedial reflex, minimum. The 3 things that I need is, one is the muscle, one is this nerve, and one is this nerve. You need all the 3 things so that you can have a normal stapedial reflex. And if any of the 3 is gone, then there is no reflex. No dampening will happen. If there is no dampening, no reflex, what is this condition called? That condition is called hyperacusis. So in hyperacusis, there is no stapedial reflex. In hyperacusis, there is no stapedial reflex. And therefore, how will this patient complain or present? Yeah, this is intolerance to loud sound. This is intolerance to loud sound. So patients say, I have no problem. Only when there is loud sound, I feel irritated. I feel it is too much. I can't tolerate it. Normal sound, when I talk to me, when somebody talks to me, conversation and all is okay. But loud sound, I feel irritated. If you have examples of loud noise that is causing this problem, the very usual answer is blow of a horn of a car or vehicle, you know. So that is every time somebody blows the car horn, I get very irritated. And also bell in the house, that bell. So these are loud noise and they cause irritation. So straight away, but when I talk to somebody, no problem. I am absolutely comfortable. So that's a very good example of hyperacusis. So what is damage? If I tell you, a person comes to me and tells me normal conversation, I'm okay, but when there is a loud noise, I get irritated. What is damaged? It could be stapedius muscle, it could be seventh nerve, it could be eighth nerve, or a combination of any of the three. At least one of the three gone will have a hyperacusis, right? And how do you find out? You do a tympanometry. The investigation you have to do is tympanometry. What is the investigation we did for station 2? Same tympanometry, right? So this completes the anatomy of the middle ear, which is the most important anatomy of ENT. Let us revise and see how much time it takes to revise the anatomy of the ear. Note the time. Check the time. And we'll do the revision. Stopwatch starts. Okay. What is the shape of middle ear? Matchbox. Because it has 6 boundaries, 3 compartments, and 3 ossicles. The top boundary, the top compartment is called epitympanum. Epic. The middle compartment is called mesotympanum, and the lower compartment is hypotympanum. 3 ossicles, malleus, incus, stapes, and the 2 joints. The first joint is called incudo-malleolar joint, is what type? Saddle joint. And the second joint is incudo-stapedial joint, is what type? Ball and socket. And the 6 boundaries, the roof is called segment tympani. It separates the middle ear from temporal lobe of the brain. Below the floor, there are 2 things: a nerve and a vein. Which nerve? Ninth nerve is branch. Jacobson's, that forms a plexus, tympanic plexus, and the jugular vein. Right? What is the outer boundary? Tympanic membrane. Outer boundary is tympanic. What is the shape? Oval. Color? Curly white. वो लड़का बताएगा जो कुछ नहीं कर रहा था गाल पे. कहाँ हो तुम दोस्त? दिल्ली में तो नहीं हो, या तो रशिया चाइना. कहाँ से करके आया? बैठो बैठो बैठो. कहाँ से किया? नहीं हो तुम. आओ वापस. हो गया, वो खत्म. वो चैप्टर पास कर बेटा. हकीकत यही है, रियलिटी तुम्हारी हकीकत. I know it is sad to think of the past, such a beautiful past you had, but this is the reality. Face it, my dear friends. This is going to be a future. Are you okay now? Vapas? Okay. So there are 2 parts of the tympanic. The upper small part is called pars flaccida, and the lower bigger part is pars tensa. Flaccida has one more name, Sharpnell's membrane. And there is a cone of light, isn't it? And there is handle of malleus, umbo, lateral process, and all that. Right. Thickness is 0.1. The total area is 85 to 90, but the effective area is 45 to 50. Then the anterior wall has 2 openings. The small opening at the top is canal for insert tympani muscle, and the big opening is station tube opening. The other end of the tube opens in the lateral wall of the esophagus. The length of this tube, 36, which is bony part. Outer 1/3 is bony, inner 2/3 is hard. And there is a muscle attached called insert velli. Because of which there is a bulge, varus tuberous, and 2 functions: balance the pressure, drain the And if there is no balancing, two problems. Barotrauma and retraction. Barotrauma is more in descending. And retraction has how many grades? 4 grades. Grade 2 is touches the incus but not come on. Due to the grading? Sardine. And the best investigation for this is the okay. Then that is station 2. Then medial wall has 2 bulbs, 2 window, 2 more things. Which are the 2 bulbs? Promontory and the bulbs of the lateral canal. To stimulate the lateral canal bulbs, the patient begins to have vertigo and nystagmus. 2 window, upper wala window, the upper window is oval window, the lower window is round window, and the round window is covered by a membrane called secondary tympanic membrane. There is a facial nerve and a small fistula. What is the fistula called? Fistula and fenestra is the most common site of a disease. Sclerosis. Posterior wall has a nerve. Which nerve? Facial nerve coming out through a foramen called stylomastoid. There is a door at the top. Aditus. And on either side of the facial nerve, there is a space. One is the most ST and FR. FR is facial recess, and ST is sinus tympani. What is the importance of sinus tympani? Difficult to remove the disease, therefore recurrence is very high. And below the crown of the facial, there is a small bony projection called pyramid. And the importance is that it originates a muscle. Stapes inserts into the stapes, nerve supplies facial nerve, and the function is damping the loud noise by producing a reflex called stapetal reflex, also called acoustic. Is that now? 8 now the different nerves. 7th of the investigation is damping. And what is the function of the middle ear and the ossicles? Amplification of the sound, which is also called impedance matching. Okay. 5 minutes? Chalo, 7 minutes. But it took us more than around 1.5 hours to do that. So this is the point, that what it takes 1 to 2 hours to study in a class, when you revise and you make good notes, can be done in 10 minutes. 5 to 10 minutes. So if you attend a 10 hours lecture in a day, you can easily revise in 1 to 1.5 hours the whole day. It doesn't take much time, provided you have kept your minds open so that you remember and you have made good notes. Always make your own handwritten notes. I don't know how many times I tell this, that don't rely on the notes that are available in stationery. Don't buy it. I'm telling you, don't take the notes of your friends. I will not again you write and then you give me, we are very good friends. No. नहीं होता. बच्चा हो सकता है साथ करके लेकिन एग्जाम पास नहीं हो सकता. Okay, so don't do that. You will realize the importance of your own handwritten notes around the exam. When you start revising them seriously, then you realize the importance of your own handwritten notes. You do not understand the other notes. समझ ही नहीं आता. It's a useless effort. That is a shortcut that people take. I highly recommend that you don't take the shortcut. Sit in the class, make your own notes, and after the exam, meet me and tell me, sir, आपने जो बोला था वो कितने फायदेमंद, how important it was. It is very, very important, right? It's like, you know something, you're seeing, but childhood memory, you can see and you go, it comes to your mind, when you write your own hand, and even if you don't remember, when you read that, जैसे याद आता है ना स्कूल की बातें, अरे हाँ ये भी तो था क्लास में, कभी होता है ना कि याद ही नहीं है, and suddenly उसे हाँ ये तो था क्लास में, so that way it comes out. और दूसरी क्लास में कोई तो नहीं याद है, दूसरी कोई बच्चा दिखेगा तो पता नहीं कौन. So don't, please, this is very serious advice. Make your own notes and make good notes. Okay. And second advice is, after the class, before you go to sleep, I say this every time, that make sure that you revise today's notes. Whatever you have done, 10 hours, 2 subjects, 3 subjects, whatever, must revise today's notes before you sleep. Don't go to bed without revising the day's note. So attend every day, don't miss any class, make good notes, your own notes, and before you go to sleep, revise them. That is going to be your first revision. And how many more revisions? At least 2 more. Total of 3 revisions. One is the same night and 2 more revisions. And you have to do few MCQs. If you follow this therapy, I will write in the stamped paper that you will, no matter what you are, you will definitely clear this exam. You follow this therapy and exam ke baad mein aage sir, I followed this therapy, I did not pass. I will stop teaching. I'm telling you. So I'm telling you, I can give in writing that you follow this therapy, you will definitely, it's not a difficult exam. It's pretty simple. The only thing is it is too much. 19 subjects is too much. Nobody can remember that much. And the only option is that you revise many times. To remember anything too much, you have to revise. And 3 is the minimum revision. If you can do 4 revisions, that's even better. But the first revision must be the same evening. Suppose for some reason you are not able to revise today. Whatever. Okay? At least flip the pages. Okay, I'll not revise, I don't have time, but I'll flip the pages of the day. And just look at the bold letters that are written, even that is helpful. Okay, will you follow this? Yes, sir. Sure. Okay. So then you know about this muscle, this bone. What is this behind the bone? Behind the ear. What is this bone? Mastoid. This is mastoid. So if I use this diagram, and if I want to draw the mastoid is here like this. And the thing about mastoid is that it is not a compact bone. It is a cellular bone. Cellular means there are cavities. There is a big cavity and there are small cavities around it. This big cavity is called antrum. Antrum. So this whole thing is mastoid. Look here. I think you can identify everything here. So if you want to show the relation of the middle ear and the mastoid, middle ear and mastoid, this is a beautiful diagram to show you the relation of middle ear and the mastoid. And it's absolutely legitimate. But there's even a better method, better diagram, better angle, which is more important. So I'll show you the next thing, which is even more important than this diagram. The relation of the middle ear to the mastoid. So let's talk about that. What is the shape of middle ear? Matchbox, isn't it? Now please sit straight, everyone. Please sit straight. Chai nahi ki? Coffee? Chai? Very nice. Okay. The middle ear looks like a matchbox when you look at the middle ear from the front, which is antero-posterior view is called. When you cut the ear like this, this section is called the coronal section. When you cut the body like this, it's called coronal section. So if you cut the ear coronally and see from the front, which is antero-posterior view, the middle ear appears like a matchbox. But if you look at the same middle ear from the side, which is cutting like this, what is this section called? So sagittal section. Then it looks different. Then it looks what is called cuboid or ovoid. Shape of an egg, egg, which is something, if I have to draw the egg shape, don't draw this, I'll draw it like this. I'm fed up. Is there somebody who is cursing me? ये क्या पढ़ा रहा है, क्यों पढ़ा रहा है, all that? Something is wrong with somebody. मुहूर्त अच्छा नहीं हुआ. Yeah, the beginning was bad. The day is good, usually, but today is the reverse. The beginning is bad and the days were also going very bad for me. Anyways, I think the pen is having the battery of the pen is creating a problem. So this is how we draw the egg from the side, the middle ear from the side view. And how many compartments? 3 compartments, active, muso, hypo. If this is the anterior end and this is the posterior end, on the anterior wall there is a tube. What tube is this? Station tube. And there is a door here. What door is this? Aretus. And behind the ear there is a mastoid like this with hair cells and antrum. Something like this. So I'll draw the same diagram again, but in a continuity, which is you also have to draw this one. This is the mastoid. This is station 2. Now you know everything. This is antrum. This is aretus, door. This is atic. This is mesotympanum. This is hypotympanum. This is eustachian tube. So this is another way of showing the relation of the middle ear to the mastoid. So this is correct. This is correct. This is better. This one is better than the previous one. And this whole thing has a common name. What is the common name? Middle ear cleft is the common name for this whole structure. Middle ear cleft. We have to talk about antrum. We have not talked about the antrum. The rest we have done already. We know aretus, we know atic, we know tube and all. Antrum, you have to know 4 things. It is the largest cell. You know it is the largest cell in the mastoid. How deep is the antrum? It is 12 to 15 millimeters deep from the surface. So if you, from the surface of the bone, if you go 12 millimeters inside deep, you get the antrum. So now comes the clue. Very well. There is a septum here on the antrum, a covering called corner's septum. This name is very important. What they ask you about corner septum is, how is corner septum formed? What is corner septum basically? Remember the petrous bone? The hardest bone, the bone with the ear inside? And there is one squamous bone. So petrosquamous bone and suture between the two. So corner septum is called petrosquamous suture. It's a very, very, very important MCQ. It's a suture between the petrous bone and the squamous bone. And the last thing you have to know is the landmark of mastoid. And the landmark of mastoid is called McEwen's triangle. McEwen's triangle is a landmark for mastoid. So 4 points about the mastoid, and that's it. McEwen's triangle has one more name. McEwen's triangle is also called suprameatal triangle. This is your middle ear cleft. This is how it looks actually. Okay. So what we are going to do now, I'm going to point at the structures and you're going to identify the structures for me. Middle ear cleft. What is this? Yes? Okay, what is this? Station 2. So you know the first one. What is this? Canal for penile muscle. Right? What is this structure? Facial nerve. What is this? Bulge of the lateral semicircular canal. And this is your antrum. What is this? Promontory. This is your promontory. And what bone is this? This bone. Segment tympanum. This is the roof of the ear, and roof of the ear is called segment tympanum. So this is segment tympanum. So point is, suppose I did not tell you before this segment tympanum, but we have discussed segment tympanum. So now I'm asking you from a different angle, and you get stuck. You feel कि ये तो दिखाई नहीं है, सुनाई नहीं है ना? So this is going to happen many times in your exam. Because obviously they are not going to ask you all the straight questions. The class में लिखाया हुआ sentence में तो पूछने वाला है. They are not going to do that, isn't it? So you are going to come across many times during the exam where you feel I have not seen this or read this, I don't know this. Don't give up yet. Tell yourself, if I have attended all the lectures, I have revised also, I have done MCQs also, how is that I don't know this? Definitely, if you spend some more time thinking about this and try to use whatever you have, in the class, or try to recall that particular lecture in the class, whichever subject. Many a times you get the correct answer. Just try it. So don't give up. This is segment tympanum. But this also compares the anatomy of the mastoid. And the last part of the ear anatomy that you have to know is the labyrinth. Inner ear. Has two functions. What are the two functions? Hearing and balancing. Because there are two functions, one is for hearing, one is balancing, we have divided the ear into two parts. The part for the hearing is called the cochlea, and the part for balancing is called the vestibule. So this is a major division of the inner ear: cochlea for hearing, vestibule for balancing. But vestibule is again divided into three parts: saccule, utricle, and semicircular canals. We have three canals. We have the lateral canal, the posterior canal, superior canal. Three canals. So this will complete all the parts of the inner ear. And like I told you before also, only one cochlea for hearing and so many things for balancing. That's why I told you balancing is very complex, remember? Not only this, then you have the eye and the proprioceptors and the cerebellum all together causes the balance. So balance is really very complicated. But what is this labyrinth made up of? Actually, labyrinth has two coverings. There is outer covering of the labyrinth, and if you go inside, there is another covering of the labyrinth. The two layers. The outer layer is made up of bones. It's called bony labyrinth. If you go inside, there is another layer of labyrinth made up of membranes, and that's called membranous labyrinth. So there is a bony labyrinth which looks like this. This is how a bony labyrinth looks like. What is the other name for bony labyrinth? It's also called the otic capsule. Otic capsule is the Other name for the bony labyrinth. And inside, if you go inside, there's another labyrinth made up of membranes. Looks like this. And this is called membranous labyrinth. So bony labyrinth and membranous labyrinth, two layers of the labyrinth. And both are filled with fluid. What is the fluid inside this membranous labyrinth? The fluid is called the endolymph. Endo means inside. This is inner layer, inside is endolymph. And between this and the bone, there is another fluid. What is the other fluid called? Perilymph. Perilymph is outside. These are the two fluids, endolymph and perilymph. And they ask you, what is the main difference between these two fluids of the ear? The main difference is the difference in the main ion. Endolymph has the potassium ion and perilymph has the sodium. This is the main difference. This yellow thing is the cochlea, which is coiled. This is the base end. Remember base? And this end is what? Apex end. Remember? This is saccule. This is utricle. And these are the three canals. There is superior canal, there is a posterior canal, there is a lateral canal. Three canals in blue. So these are the different parts of the cochlea. I mean labyrinth. Cochlea, saccule, utricle, and the three canals, as you can see. This is the main labyrinth, the membranous labyrinth, the actual functional labyrinth. This is the main, means the function of hearing and balancing is happening in this membrane. This is the main thing. But this membrane needs a protection around. And the protection is a bony protection. So obviously this is cochlea. Isn't it? This is vestibule area. What is inside this vestibule? The saccule and the utricle is inside this area. This area has the saccule and the utricle. And of course, we have three canals, the superior canal, the posterior canal, and the lateral canal. Now, if you cut the cochlea here, suppose you cut the cochlea here, cut it, and look at the cut end. Suppose this is the base of the cochlea. It's going like this and it's going to cut. You cut it here, cochlea, and you look at the cut end. What does the cochlea look like? Circular. So this is a bony cochlea. The bony cochlea is circular, like this, the cut end. But the membranous cochlea is triangular, like this. So this is your bony cochlea. And this is your membranous cochlea. Outside is bone, inside is membrane. This is the cut end. If you cut and see, this is how it looks. Now, because the membrane is triangular, they have names. So I'll draw another diagram, the same diagram, similar diagram. This is the bony cochlea. This is the membranous cochlea. And membrane, as I said, has names. This lower membrane is called the basilar membrane. Why do you think it's called basilar? It is on the base, lower side. So it's called basilar membrane. This is called Reissner's membrane, and this one which is joining these two is called stria vascularis. There are three membranes in the cochlea: basilar membrane, Reissner's membrane, and the stria vascularis. And these three membranes divide the cochlea into three compartments. So which are these three compartments of the cochlea? See, one is this compartment, one is this compartment, one is this compartment. And these compartments have names. What is the upper compartment of the cochlea called? It's called scala vestibuli. And the middle compartment is called scala media. And this is called scala tympani. There are three compartments. From top to bottom: scala vestibuli, scala media, scala tympani. What is the word media means? Middle. Media means middle, so you know it's in the middle compartment. Now tell me, which compartment will have perilymph, which compartment will have endolymph? Perilymph, vestibuli and tympani. And endolymph, media. So this will have potassium ion, this will have sodium ion, and this will also have sodium ion, isn't it? So that's logical. But the most important thing to remember are the three membranes and the three compartments. But in the cochlea, for hearing, the most important thing that you need is the sensory organ of hearing. What is sensory organ of hearing also called? Organ of Corti. This is the most important thing, single thing for hearing. Organ of Corti. Without organ of Corti, you simply cannot hear. You may have everything else, no organ of Corti, no hearing. So where is the organ of Corti present? Where is it present? On the basilar membrane. Can you see the basilar membrane? On. So here. This is your organ of Corti, like this. So organ of Corti is present on the basilar membrane in the cochlea. The most important thing that I need for hearing is this organ of Corti. And what is organ of Corti made up of? Formed by? It is formed by cells, hair cells and supporting cells. Organ of Corti is formed by hair cells and supporting cells. And hair cells are of two types. What are the two types of hair cells? One is inner hair cell, one is outer hair cell, plus there is supporting cell. So ultimately, we have three types of cells. Which are the three types of cells? Inner hair cell, outer hair cell, and supporting cell. These are three types of cells in the cochlea that you have to know. And now comes a very important thing that they ask you in the exam. There are some differences between this inner hair cell and the outer hair cell of the cochlea. So we make a column like this and discuss the difference between the inner hair cells and the outer hair cells of the cochlea. let us decide the differences between these two. It's a very, very, very important thing that we are doing now. Actually speaking, there are 7 to 8 differences between the two, but I'll tell you only 4 very important ones. Like the shape. Shape is different. Inner hair cell, we draw it like this, and we call it flask shape. Outer hair cells are straight, and therefore either they are called tubular or they are called cylindrical. They're tube-like or cylinder-like, tubular or cylindrical. Which are more in number, inner or outer? Inner are less, 3,500. Outer are more, 12,000. It's a huge difference. Therefore, tell me, which can fit in a single line, which will fit in multiple lines? Obviously, inner are less, so they can fit in single row. Outer are more, they need multiple rows to fit. So that's the logical. The next difference is inner hair cells has no emission, but outer hair cell produces an emission called autoacoustic emission. OAE in short. Now this is a very, very, very important MCQ. Who produces the autoacoustic emission is a very important, and the answer is inner hair cells. Outer hair cells produces the autoacoustic emission. And the last difference is, relatively, inner hair cells are more resistant and outer hair cells are more sensitive. Meaning, they are more sensitive to damage. The inner hair cells do not get damaged easily. They are resistant, tough, they're tough. But outer are more delicate or sensitive, and therefore it is easy to damage the outer hair cells. Who will damage? 2 things. Loud noise. Loud noise, loud sound can easily damage the outer hair cells. And the outer hair cell is gone, the organ of Corti is gone. And I told you for hearing, organ of Corti is the most important thing. So you can't hear. That's why you cannot allow the loud sound. And so we have a protection for this. Yeah, what is that protection called? A reflex. Stapler reflex, acoustic reflex. Isn't it? I told it is for protection. So if you ask me what does it protect? It protects mainly the outer hair cells of the cochlea. But the other thing that can damage are ototoxic drugs. Ototoxic drugs can also damage the outer hair cells of the cochlea. There are some medicines which can damage them, and they are called ototoxic drug. Can you name some important ototoxic drugs? Aminoglycosides are the main ototoxic, like gentamicin, streptomycin and all. Gentamicin, streptomycin, amikacin. These are all aminoglycosides, and they are all ototoxic drugs. There are many more, but these are the main ones. Right? So this will complete all the important points in the anatomy of the inner ear also. And which is the nerve of the inner ear? 8th nerve. This is the nerve of the inner ear that we know already. But 8th nerve divides into 2 branches. One is the cochlear branch It goes and supplies the cochlea. And vestibular nerve which again divides into superior vestibular nerve and inferior vestibular. So from the eighth nerve, ultimately we have three nerves: cochlear nerve, superior vestibular nerve, and inferior vestibular nerve. These are the three nerves ultimately from the eighth nerve. But ear has one more nerve that we discussed already. The seventh nerve. Remember the seventh nerve? Facial nerve, we have discussed this in the middle ear. So ear has these four as the main nerves that you must remember the name. Cochlear, superior vestibular, inferior vestibular, branch of eighth, and facial is a different nerve. But all these nerves, they come from the area of the brain called pons. They all come from the pons in the brain and enter inside the ear to supply the ear. And the thing you have to know is, what is the entry point for these nerves? Where do they enter from? That's a very important. So I'll draw the similar diagram. Pinna canal in panic membrane, middle ear. In the inner ear, there is a canal here, and these nerves they enter from this canal. So in the inner ear there is a canal for the entry of these nerves. So this side is pons. There is a pons here from where the nerve will come and they will enter inside. What is the name of this canal? It's called internal acoustic meatus. IAM in short. Internal acoustic meatus. IAM in short. How many nerves in the IAM? How many nerves? 4 nerves. Which 4? These 4. Vagus. These 4 nerves. Cochlear, superior vestibular, inferior vestibular, and facial. In the internal acoustic meatus. So because there are 4 nerves in the internal acoustic meatus, this meatus is divided into 4 compartments. By a cross. There is a cross. One bone goes like this. Let me use red color. One goes like this. See? So you have 4 compartments inside. And one compartment is for one nerve. So each of these 4 nerves has its own compartment. So there is no mixing of nerves. There is no problem amongst them. Single room. Flat. Single room hostel. सबको एक room मिलेगा. Sharing नहीं है यहाँ. No sharing of rooms here. So, and in the canal, if you want to create 4 compartments, the best thing is cross, like the cross, red cross that I see. 2 bones, one bone goes vertically like this, one goes horizontally like this. This vertical bone has a name, this one. And the name is very, very important MC. What is the name? This vertical bone is called the Bill's bar. This is another very important MCQ. What is the vertical bone in the internal acoustic meatus called Bill's bar? So how many compartments now? How many compartments in the internal acoustic meatus? 4. One is antero-superior, anterior and superiorly. One is below that, antero-inferior. One is behind that, posterior-superior. One is this side, one is this side, one is this side. On the right here, one is here, one is here, one is here, one is here. So antero-superior, antero-inferior, posterior-superior, posterior-inferior. Isn't it? Four nerves. These are the four nerves. Name the four nerves. Let's go another. Nerves. This. Nerves. Cochlear, superior vestibular, inferior vestibular, facial. And four compartments: anterosuperior, postosuperior, anteroinferior, posterior. And the question they ask is, facial nerve is which compartment? Facial nerve in the internal costumate is this compartment: anterosuperior, postosuperior, anteroinferior, posterior, which is the correct answer. Will tell me the answer. Anterosuperior compartment has the facial nerve. So facial nerve in the internal costumate is present in the anterosuperior quadrant. See, I'll tell you something very interesting. If I draw the four quadrants like this is antero, this is postero, this is superior, this is inferior, right? And I tell you, facial nerve is here, isn't it? Anterosuperior. This is Bill's bar. This is Bill's bar, right? Can you tell me which are the other three nerves on which nerve is where? Make a guess. Use your common sense and try to tell me which nerve is where. Read the names of those rest of the nerves and try to figure out. Yeah. See, only one superior compartment left. Superior compartment must have a superior nerve. So which is the superior nerve? Superior vestibular nerve has to be here. And what is going to be below the superior nerve? Inferior vestibular nerve. So what is left for this? Superior nerve. Isn't it? So you can actually figure out if you use your logic. What do you say? बात में तो दम है ना? बात में दम है, इस लाइफ में कोई गम नहीं है. So this is how the internal caustic meatus looks like. Facial nerve is here, superior vestibular nerve is here, superior vestibular nerve, inferior vestibular nerve is here, and cochlear कहाँ पे मेरे दोस्त? ये गड़बड़ है, ये this is unfair है ना? This is not fair. So this is inferior vestibular nerve and this is cochlear nerve. So among these nerves, which is the most important nerve for you from the exam point of view? For you, the most important nerve is the facial. Actually, in the entire ENT, pura ear, nose, throat, everything, this is the most important nerve for you on the exam point of view. This is where they ask the questions from. And we all know it comes from the pons, enters the internal caustic meatus, anterosuperior quadrant, and ultimately this nerve will go where? To the middle ear. Waiting for you to finish your thing. Anything special? Can you share what you're talking? Okay. So, again, I draw the same diagram. Pons is here. This is your pons. And all these nerves will come from the pons and, travel to the internal caustic meatus and further. And I told you, we'll only discuss the facial nerve. So, this is the nucleus of, let's say, facial nerve, the seventh nerve. We are ignoring the eighth nerve for a while, which is less important. And if you remember, facial nerve has to enter ultimately the middle ear. Remember, it's in the middle ear we discussed? So this nerve is going to travel through this canal and go to the posterior wall of the middle ear. And the posterior wall goes down and then out through a foramen. Which foramen? The foramen through which the facial comes out from the ear. Stylomastoid foramen. So after that, it is scallop. So this is how it enters. You can see that from the pons, the patient will cross the internal acoustic meatus. He will also cross the labyrinth and then enter the middle ear. And then from the middle ear also it will go out to the muscles of the face. Where does it go ultimately? Muscles of the face. That's why it's called facial nerve. And on its pathway, facial nerve has branches. How many branches does the facial nerve have? Seventh nerve has 7 branches. So very easy to remember. Seventh nerve, I'll use black color. 7 branches. Seventh nerve, 7 branches. Easy to remember. How many branches name you already know? How many branches have we discussed already out of 7? Think about this. We have mentioned or talked about today while you are doing anatomy. One, he says nerve to stapedius. Remember stapedius muscle is supplied by a branch of the facial nerve. It is efferent in the stapedial reflex. So that nerve is the third nerve, the second nerve. It's called nerve to stapedius. So the stapedius muscle for the acoustic reflex. It is efferent, am I right? And it will cause hyperacusis. If it is damaged, it can cause hyperacusis. So this one we have discussed, so it's easy. Any other nerve? Somebody raise your hand who said that? Correct? It was correct? Yeah, say. She said, remember there are 5 nerves in the canal? A, and then greater and the lesser. Which was the third A? Auricular branch of facial nerve. So this is the third branch. Auricular branch of facial nerve. And this supplies the skin of external ear. It is one of the 5 branches, skin of the external ear. So this also we have discussed. It's not a difficult thing. Fifth and sixth, I've written them together. You can ignore this. We're not going to discuss. They're not important. So forget these 2. Now, how many left to discuss? 3 nerves. Isn't it? And these 3 nerves are the most important branches of the facial nerve that you have. So these 3 many branches are very, 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 very important. So let us talk about the first branch of the facial nerve. The first branch of the facial nerve is called greater superficial petrosal nerve. Greater superficial petrosal nerve, or if you call it greater petrosal nerve, it is okay. If you don't use the word superficial, it is still okay. I call it GSPN. Have you heard the channel called ESPN? This is GSPN. There is no sports here. It is all about ENT. ESPN, GSPN. Easy to remember. But this nerve changes its name later on. And the name will change and become radian. It becomes radian nerve later on. And this radian nerve supplies 2 types of glands. Lacrimal gland and glands of nose and sinus. Glands of nose and sinus. So these are 2 categories of glands that are supplied by this first branch of the facial. You have to know this name, radian nerve. It's a very important name. You must know it is formed by the facial nerve branch called greater superficial petrosal nerve. What is supplied? Lacrimal gland and glands of nose and sinus. What does lacrimal gland do? Tears production. So which cranial nerve controls your tears production? Facial nerve. The tears that are produced. So facial nerve is very important. It plays a very important role in your emotional status. Right? The question they ask you is, can facial nerve trauma cause dryness in the eye? The answer is yes. If the facial nerve is gone, the eye, there is no more tears, so there is dryness in the eye. And dry eye can be a very dangerous thing, you know this. Ophthalmology, exposure keratitis and all that, they'll talk about that. Okay, so very, very important now. The fourth branch is chorda tympani. This is the most popular branch of the facial nerve, the chorda tympani. And it supplies three things. It supplies taste buds on anterior 2/3 of tongue, not the entire tongue. Please note, it does not supply all the taste buds, it supplies most of them. So your taste of the food that you get is mainly because of the facial nerve. And it supplies two glands, submandibular gland and sublingual gland. What do the two glands do? They produce saliva, 75% of saliva. They together produce 75, most of the saliva. So saliva production is also mainly controlled by the facial nerve. And the seventh branch, last branch. I'll come to this, but if I draw this diagram which I've done before, like this, and I draw the facial nerve like this, remember? There's a stylomastoid foramen here, right? It is out of the ear. Where does it go? After it comes out of the ear, where does it go, this nerve? There is a gland here. There is a gland here. Which gland? Parotid gland. So there is a parotid gland here. Parotid. And there is a face here. Okay. Like this. So this nerve enters the parotid gland. This is a seventh branch. This is the last branch. 7 branches. And what happens in the 7th branch? It divides into 5 branches again. The 7th branch again is divided into 5 branches. And they will go and supply face muscles here, 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 here. 5 branches. Like this. All the muscles are the face. So what I'm trying to say is the 7th branch in parotid gland. It divides into 5 branches, and these 5 branches have a common name. What is the common name for these 5 branches of the 7th? They are called pes and sarinus. They are together called, this group is called pes and sarinus. And what do they supply? All facial muscles. All facial muscles. And this is the end of the facial nerve. And because the facial nerve ends by supplying the muscles of the face, that's why the name is facial nerve. That's how it gets the name facial nerve. Okay? Now please listen to this very carefully. Facial nerve is not only supplying the facial muscles, it is also supplying other muscles like nerve stapedius muscle, for instance, we discussed. Isn't it? That is not only muscles, it is other things like the glands also. Lacrimal gland, glands of nose and sinus, submandibular gland, sublingual gland, so many glands. That is supplied the parotid gland. Does the fission of supply the parotid gland? The answer is no. It passes to the parotid gland but does not supply the parotid gland. So don't make a confusion. Besides, when I said it is in the parotid gland but does not supply that. Okay. But it also supplies something else. It supplies the taste buds also. Taste. See, fascia of supplies muscles. Am I right? Motor fibers. It supplies glands. It supplies skin. It supplies taste buds. Is it not true? So the fibers that supplies the gland are called parasympathetic fiber. The one that supplies the skin are called sensory fibers. And taste buds are called taste fibers, of course. So how many types of fiber the fascia nerve has is a question. Fascia nerve has 4 types of fiber. It's very logical. 4 types of fiber. So which are these 4 types of fiber? Motor, parasympathetic, sensory, taste fibers and all that. And if you read your anatomy jargon, in anatomy these are called SVE. What is SVE? Special visceral efferent. Special visceral efferent. This is called GVE. General visceral efferent. This is called somatic. These are called special visceral afferent. This is afferent. So if you read your anatomy books, you'll read this jargon like SVE, GVE, SVA, GVE, and all this. So in case they ask you, just you can keep this in mind. These names. Which type of fiber is what? Not very important from the ENT point of view. Maybe in anatomy they can ask you, not in ENT, but in case, just I think. General visceral efferent. You don't have to know this. This is somatic and this is special visceral afferent. So these are the few things. Fascia nerve anatomy is important. Chances of questions are very, very high. So don't ignore it. Fascia nerve is very long. If you start talking everything in fascia nerve, it takes almost 2-3 hours when I teach fascia nerve in PG. So next time when we come back again for PG exam, then we'll discuss fascia nerve in more details. Till then, this is okay. So are you coming again next year for PG? Yes. How many? Confident, yes, I'll PG, I'll come for PG. So most of you are not confident. I'm not going to pass and you don't want to do PG. Which are the two? और डॉक्टर ही छोड़ देंगे इसके बाद कुछ और करेंगे इंजीनियरिंग करेंगे. Okay. So facial anatomy of the ear is done, and I can guarantee that at least one question, at least one, maybe 2 questions from the anatomy of the ear. So what is the next topic? Investigations. And again, we have 2 categories of investigations, one for hearing, one to check the balancing. The hearing tests are called tuning fork test, audiometry, tympanometry, BERA, these are some of the tests that we will deal and talk about and discuss. These are the other vestibular function tests, the red ones. There are many more. The list is very long. The list is very long. We shall discuss the ones that we have written with black. The 5 in the hearing test category will discuss all of them, and the 2 in the vestibular category will discuss both of them. The one with red that I have written will not discuss them, but you have to know the name. Names are very, very important. If I ask you what type of test is a posturography, for instance, if I ask you what type of test is this, you must be able to say it is a vestibular function test. Or what type of test is a hint test? It's a vestibular function test. So you should know that much. What is the most commonly used frequency in a tuning fork? 512 Hertz is the most commonly used frequency in a tuning fork. Do you know the names of the tuning fork test? Tuning fork test? Release Weber's, Swarax, UBC, Kelly's, Audience, sorry. But we'll discuss them tomorrow, not today. Right? So we'll end the class today here. I'm not going to show you this slide again tomorrow, so you must already have written this and these names, so that we'll save that time. Like we promised, we'll come back, revise today's structure part. How many of them will revise today's part before you come tomorrow morning? Raise your hands. How many revise? You confident that you revise? You not revise? Right? नहीं करोगे? Last, those two don't revise. Okay, who will not revise? Anybody thinks?